We get a lot of questions asked as people like yourself are preparing for surgery. I'm going to try to go through these questions, and yet if there's questions still unanswered, please reach out to us and let us know, and we'll do our best to get you an answer right away. Eating and drinking before surgery depends on the kind of sedation that you're going to have. If you do oral sedation with like a halcyon type pill, you can eat right up until surgery. If you do nothing, if you just have us get you numb, you can eat and drink right up until that surgery. But if you're going to do general anesthesia, which means the anesthetist is coming, they're putting you to sleep, you need to stop eating 8 hours before that visit. If that is going to be a concern to you, please discuss this with the anesthetist to see what they can do to give you some guidelines that allow you to eat just a little bit more, and we'll get you through that. Now, that being said, there are some medications that we typically ask you to take before surgery. You would take those 2 hours before surgery with just a little bit of water, because after 2 hours before surgery, you shouldn't even be drinking clear liquids. And so that, I hope that gives you a better idea on what to expect in terms of what you can eat and drink before surgery. When you are having general anesthesia, it means that the anesthetist is involved, and it means that they are starting an IV, and for them to have access to place the IV at your elbow, we recommend that you wear a short sleeve shirt. Now, let's say we don't have an anesthetist, but you're still having surgery done. Sometimes, more often than not, we are drawing blood and we're using that blood to centrifuge it and pull some of the things out of it that we can mix with your graft material to improve the healing of that graft. They're growth factors that will help you heal better. For that, we also need access to those elbows. So typically, when you're getting ready for surgery, come with a short sleeve shirt. Loose fitting makes it easy for us to gain access to the things that we need. On top of that, what I recommend is you're going in for surgery. Do not wear a nice bright white outfit. Don't wear your favorite shirt. We do cover you up, but if a drop of blood were to get on your favorite shirt, we would feel horrible. So just wear some clothes you don't care about, loose fitting, short sleeve, and we'll be good. Do you really have to wear an adult diaper? The answer is unfortunately yes. The reason for that is with longer procedures, you're asleep and you don't have control over everything that's going on in your body. And we've had it happen more times than I'd like to admit, where a patient has not worn something and they've had an accident in the chair. And if that were to happen, we're fine cleaning up that, and we're in a position to do that. But you would then need to change your clothes. You don't want to get it all over your car on your drive home. So it is a much better idea, and we have come to require it, that you wear an adult diaper for the procedure, for the betterment of all of us. For us, for you, for the ride that's getting you home. Everybody's happier when you wear that adult diaper. If you were to forget and you show up without it, we will do whatever we can to help alleviate that. That could be that we have some on hand, could be that we lay something onto the chair, but that doesn't always mean that you wouldn't be going home with wet clothes. So please, please, please get the adult diaper and wear it to surgery. The number of implants that we place for somebody getting a full set of teeth is not something I can tell you on a video, because it's different for everybody. What I can tell you is our philosophy. Even though we only charge patients for the 4 implants that are the minimum requirement, if we find that you have enough bone, we're going to place 5, we're going to place 6. We're going to place the amount of implants that we feel is right for your anatomy. And there's certain distances that we like to have between your implants, and we're not going to go long distances between our implants. We'll add more implants so that we get the proper amount of support. But I will tell you that typically it falls somewhere between 4 and 6 implants. One of the most common questions that people have, and maybe a concern that some people has, is, will I leave the day of surgery with my teeth? Sometimes people even want me to guarantee that they're going to leave the day of surgery with teeth. Unfortunately, nobody, us included, can guarantee that those implants are going to be tight enough for us to be able to attach teeth to them at the time of surgery. But let me just kind of pull back the curtain a little bit and help you kind of know what happens during surgery, because we want you to have those teeth attached to the implants. It's better for you, it's better for us, it's better for everybody. So we do whatever we can to ensure that that can happen. So this is how it goes. If we begin the process of getting your implant in, and typically the way that is you drill a small hole, you drill it bigger, bigger, bigger until the implant goes in. If we start with that first drill and we notice that your bone is softer than the average person, we immediately change the direction we go and we switch to some specific special drills that don't cut your bone away, and instead it pushes it out to the side so that we're keeping as much bone as possible. That allows us to take medium situations and turn it into a good situation. But there are still going to be instances where that's not enough. So when we are trying an implant in and it's not tight enough, do we stop there? No. We try some things. We can go with a wider implant and an even wider implant and an even wider implant sometimes. We can go with a longer implant if your anatomy allows. But these are all things that we do at the time of surgery to help get to a point where your implants are in tight. Can I guarantee that all of our efforts are going to work? Unfortunately, I can't. Sometimes, despite our efforts to get implants in tight, we don't get the tightness that we're after. I'm going to explain two situations. Let's say that we were able to get 6 implants in, but only 4 of them were tight, and the other 2 on this side are not tight. Often what we'll do in a situation like that is we'll still attach teeth to the 4 tight implants while leaving those 2 that didn't get tight enough alone. What that means to you is if you smile, you might notice that there's some missing teeth on this side. It's just for the temporary, and in your finals you'll get a full set, but we've found that most people prefer that over going home in a removable denture. So that's one scenario. Let's say that you only have enough bone for 4 implants, and 2 of those 4 implants is not tight enough. Unfortunately, we can't use only 2 implants to support a set of teeth, so we're going to have to just cover up all 4 of those implants. So the implants are still there, and over the next 4 months, bone is fusing to them, but they're completely buried under your gums. You won't see them, they're hidden, and in the meantime, you're going to wear a removable denture. We do not like that to happen. You don't want it to happen either, and that's why we're going to take all these actions, but you have to go into this with that understanding that this is a possible outcome. And we'll get you through it, and eventually we'll be able to attach teeth to your implants. When we have a discussion about pain after surgery, I like to first step back and point out that you are going to be having surgery. It's not so much will there be pain because I have surgery, as much as how well will I be able to manage my pain? And that's the question to really ask, because we expect that if you do nothing and you just have the surgery done, you will have pain. But that's why we prepare you. That's why we give you certain medications. If we feel that there's going to be significant swelling, we're going to give you a steroid to calm the swelling, to keep it down, because less swelling means less pain. We're also going to prepare you for different levels of pain management, so that if you only have mild pain, you're ready for it. But if you have moderate to severe pain, you're also ready for that. Our philosophy has been that most people, we give them a prescription for a heavier dose of ibuprofen, and that is to manage most people's pain, especially mild pain. Sometimes that's enough to cover moderate pain, but if it's not, we know that you can take that ibuprofen and still supplement it with Tylenol. And what we like to do is have you stagger it so that you're taking ibuprofen, 3 hours later, Tylenol. 3 hours later, ibuprofen. And by doing that, now you can take almost twice as much pain medication without hitting the limits of either of those 2 things. Now, let's say that's still not enough for you. We've also provided you with a heavier medication, like a narcotic medication. Now, usually these kinds of medications are variable for people. Sometimes it's very upsetting to one's stomach. Sometimes people do just fine with it. we want you to use this as your last resort. If you use those medications, they often have Tylenol in them. So you just have to realize that if you are going to take those stronger medications, commonly we use one called Vicodin, which has hydrocodone and Tylenol. If you're going to take a Vicodin, you have to pay attention to how much Tylenol you've taken. I would just say for every Vicodin that you take one less of that Tylenol. But think of it more like that. Like, not will I have pain, it's what will I do to manage the pain that would be there otherwise. And that's the answer, is to have take the right medications, be on top of it, sleep upright for the first couple nights, get the nutrition, get sleep, stay on top of all those things. And what I find, because I call everybody the day after surgery, what I find is I talk to people who have been through this procedure is that most people give me wonderful news. I've heard people say, I have no pain. I've heard people say, I am just taking the ibuprofen and I'm doing just fine. It's probably more often that that's what I get from people. And occasionally people say, it is painful, but I am taking the heavier stuff, the Vicodin, but I'm fine now. And that's what I expect when I call you to see how you're doing after surgery. Diet is one of the things that we preach a lot here at Revive Dental Implant Center, because we know that if we've attached teeth to freshly placed implants, one of the things that will damage our journey, that will cause things to fail, is if you are using those new teeth on those new implants in ways that they're not intended to be used. So we push very hard for what we call a soft food diet. And the instruction that we usually go to is if you can cut through it easily with a plastic fork, you can eat it, okay? And I'll take it one step further and give the theory behind that. What we don't want is we don't want you squeezing through your food. If you can put something in your mouth and lightly grind it up, you're going to be just fine. These are foods like pasta, ground meats like ground beef, fish, bananas. That could be one whole category of food that really makes it easier for you to decide if you can eat it is canned foods. When things get canned, they have to go to a very high temperature. Most foods break down and they don't end up being as hard. They're very soft. If it's been in a can, usually it's very soft and it's something that you can chew. But that's the idea. And the thing, I always like throwing some bad examples. Beef jerky, horrible thing. Well-cooked steak, horrible. Raw vegetables, especially a raw carrot. All of those foods, if you think about how you have to really squeeze your teeth together to get through it, you got to stay away from those kinds of foods. But honestly, for the first week, I would even stick to liquids, near liquids. So we're talking protein drinks, applesauce, yogurt, pudding. At most, I would say maybe scrambled eggs. Things that really don't require any chewing. It's either put it in, swallow it, or put it in lightest chewing ever, and then swallow it. So hopefully that gives you an idea and hopefully some confidence in knowing what it is you can eat throughout this whole process. Assuming that everything goes according to plan, the way this works is from the day we have surgery, we get you back 2 or 3 weeks later. What we want to just see, are you healing fine? How is everything going? Make sure all the screws are tight and give you some new instructions on cleaning. That's that visit 2 or 3 weeks out. Then we're going to see you about 8 weeks out. So 2 months after your surgery, we're looking again, we're checking everything again, we're making sure everything is good. From that time, we want 4 more weeks for you to heal before we turn you over to get you started on making something permanent, something out of zirconia. And so what that means is that you'll start the process at about 3 months after surgery of starting those permanent teeth. Now, that does take some time. There's multiple visits, at least 3 visits to get that process started, and that does take some time. So I would say start to finish, from the day of surgery to the day you're getting into your permanent zirconia teeth, if that's the journey you've chosen, 5 to 6 months is how long it takes to get through that.